Hi, Sister Bufre. Good evening.
Hi, good evening.
How are you doing?
I'm very fine, and you?
I'm very well too. I can see you are
Okay.
coming back from work. Sorry for disturbing.
Yeah,
I'm going to take a little bit of your time.
it's okay.
Okay, let me quickly share the screen so that we can talk about what we are going to discuss today.
Okay.
Can you see the screen? I'm going to talk about respiratory system disease and disorder.
Okay.
So I will share three case study. Then we will talk about it.
All right.
So the first case study I would like to talk about is infants dead. Let me get there. Sudden infant death syndrome. Have you heard about it before?
Okay.
Like a situation whereby a baby just die like that, maybe from their sleep, from age 10 to 12 weeks. Like the baby is not sick, nothing is wrong with the baby. The baby will just die like that. So
Okay.
you can see the description. It says completely unexpected and unexplained death of an apparently normal and healthy infant, usually at age
Okay.
10 to 12 weeks. And the cause of this
Okay.
particular syndrome is unknown.
Like you just give birth to a baby, and before you know it, the baby just died. Maybe in the hospital or at home.
Yes, like,
They think.
wait, it's not like immediately after birth. It's from 12
Okay.
or 10 weeks or a year. Like the baby is healthy. Nothing is wrong with the baby. The baby is not sick.
50-50.
Maybe the baby was
Okay.
sleeping. Then all of a sudden you just maybe you want to
He
wake
died.
the baby
Yeah.
for food. You realize that the baby is gone. So you can see they say the cause is unknown. Medically, they can't find out what is the real issue of this particular syndrome or the cause of this particular
Okay.
syndrome. And they said,
Yeah, because
okay,
yeah, yeah, because here we have issues like that, and some people normally say that is wizard, witches, and things like
yeah,
that. The baby will just die. Okay.
yeah. So signs and symptoms, they say no premonitory signs and symptoms. It doesn't have any signs, no symptoms whatsoever. So when found, the infant is dead and may have mottled skin and may be blood pink sputum. Okay, you only notice that the baby is dead when you notice that the skin is not bright like somebody that the blood is still running on the vein.
Okay.
You see the diagnosis procedure, even there is no treatment for it because they don't know
Yeah.
what really caused this particular syndrome.
Dead.
Yeah, there is no treatment for it. Then
Okay.
you see the prognosis, they say currently believe that the children are no longer at risk of sudden infant death by age 1. Okay, so medically, majority of pediatricians, they are working on this particular case to know what is really causing this particular death syndrome. Okay, that's
Yeah.
why if you go to the hospital, maybe when someone is pregnant, you will follow the person to the hospital for antenatal this thing care. Some of
Yeah.
the advice they give to pregnant women, they will tell you not to be lying down on your back. You should try as much as possible to be lying down by your side and try. There are some certain things they will tell you to, observe during your pregnancy because you don't really know what exactly causes this particular syndrome.
Okay. Yeah.
When according to, because I asked question, according to one of the a midwife that was talking about that, that was educating pregnant women. He said if you lie down on the back, that the baby inside you will not have the blood flow. The blood flow,
Yeah.
like the food they suppose, the air they breathe inside will stop. If you lie down on your back, the air will
And
stop.
naturally, when you are pregnant, you shouldn't be lying down. Even yourself, you will be having short breath. You
Yes,
will not
yes,
be breathing well. So
yes.
compared to the child.
So yes, so that is the issue. So all these things, if you go to antenatal, you'll be advised on certain things like this because you don't really know what is the cause of this sudden infant death.
Yeah.
So I don't know if you have any question on this.
No, I'm okay. I'm okay.
Okay, so the second case study I would love to discuss is thrush.
Okay.
Okay, so this is yeast infection of the mucous membrane lining of the mouth and tongue, commonly seen in infants. I used to see it. Like you see white stuff like a newborn baby, breastfeeding, or still taking milk. You will see white stuff in their tongue or in their mouth. So this is yeast infection. It is called thrush.
Okay.
Okay, so it says this the causes of this is small amounts of candida fungus. It can affect men, it can affect women, even children also.
Yeah.
And the signs,
Yeah.
okay,
Is this is okay? I from this what you are teaching me right now, I can see that it's gist infection. I
yes,
didn't know that gist can affect someone's mouth. I was always thinking that it's only um maybe private part or
yeah,
so, like vagina, and I didn't know. So now I know that there is gist, mouth gist, and like
yeah.
that.
It's called thrush or oral candidiasis.
Yeah.
So when you notice some white rashes in your mouth, okay,
Okay.
so you know that it's called thrush. Yeah, so it
Okay.
affects children and men and women. Okay, and the signs and symptoms are whitish, velvety lesion in the mouth and on the tongue. Tissue
Yeah.
underneath lesion easily bleeds. Okay, maybe you were brushing and you see some blood coming out from your mouth. You should know what the
Yeah.
problem is. Okay, you can see treatment plans. It said infants are seldom treated because it disappear in less than 2 weeks. Then for
Yeah.
others, eating yogurt or taking over-the-counter acidophilus capsule helps. Antifungal capsule also helps. And there is this antifungal tube cream that will be prescribed for you in the hospital. It also helps in the treatment of thrush.
Okay.
Do you have any question on that?
Yeah, I'm okay. I'm okay.
Okay, so the last discussion of the day is going to be lung abscess.
Okay, love absence.
Lung abscess. Okay, so this one has to do with lungs, an area of necrotized lung tissue containing purulent material caused by
Yeah.
infectious organs, and it may be complications of pneumonia, aspiration of infectious material, and is the most frequent etiology. You can see the signs of symptoms. It's called
Do you know
accompanied by
what
mucus.
I just find out from here? Like this one of the signs and symptoms is very, very common here. Like they say smelling, spectrum, and breath.
Mhm.
Like we normally see people who has a very bad mouth odor.
Yes,
So could it be part of it?
it might be. It might be.
Okay.
Because some of these disease and disorder, they have similar symptoms and disorder. Okay. So
Okay.
it might be. And it, like you say, if you see somebody that is suffering from lung abscess, the person can easily cough out blood. It will have
Yeah.
chest pain, and the person will be sweating uncontrollably, feel headache, and a lot more fever and diarrhea.
Okay.
So if you see somebody like with this, like you say, it's a foul smelling sputum, you'll be able to know what the person is suffering from. Okay. And you can see the treatment, antibiotic therapy, very long duration. Surgical resection of the lesion may be required if antibiotics are not successful. Okay, at some
Yeah.
point,
Okay.
the antibiotics given might not be okay for the person. You know, we have different body types.
Yeah.
The antibiotics might not work for the person, so the person or the doctor will, suggest surgical resection to help the person.
Okay.
Do you have any contribution or?
Yeah, no. But I just discovered that this might be a disease or ill illness, okay? Because before I used to, some people would say that is the smell, this person have a very bad smell that come out of the tummy. Now I know that it's lung abscess. So anytime I see people like that, because there are people who has a very bad odor, bad breath, I would just try to maybe tell the person to go for checkup or x-ray also.
Yeah, yeah. That's very nice. It's true. And for you to even prevent it, you have to go for adequate dental care and
Yeah.
prevent aspiration through proper care of anyone unconscious.
Okay.
This is very, very important because this particular illness, if you don't arrest it on time, it might be dangerous to one's
Yeah.
health. Uh, it might develop other things that will need
Okay.
urgent medical treatment.
Okay.
So, Mr. Kufre Akbabi, I believe we've learned one or two today. At least
Sure.
if you are asked or if you see somebody that has these three diseases we've discussed this evening, I believe you'll be able to identify the the illness,
Possible solution.
yes, and
Yeah.
also know how to address the person or talk to the person about the illness.
Thank you. Yeah.
Thank you very much for your time. I really appreciate.
You're welcome.
Thank
You're
you.
welcome.
See you
You're
again
welcome.
next week. Bye.
All right. Bye.